Hey, how you guys doing? My name is Dr. Bleam. I just want to show you a couple of exercises you can use to help to increase your thoracic mobility. Increased thoracic mobility should lead to a wider shoulder turn, which should lead to hitting the ball a little bit farther. So the first thing we're going to do is a pretty simple exercise. I just want you to sit on the floor. We're going to sit Indian style. What I'm going to ask you to do is we have to really make sure that we're maintaining the lumbar stability by engaging our core prior to doing this exercise, because we only want to work on thoracic mobility. So what I'm going to have you do is lay your arms across your chest, sit up nice and straight, contract your core, and what we're going to do is we're going to rotate and also add some lateral flexion. So we're going to rotate slightly, a little bit of lateral flexion. Come back up, rotate slightly farther, a little bit more lateral flexion. Slightly farther, a little bit of lateral flexion. Now I'm really focusing on making sure that the motion is coming from the thoracic spine and not from the lumbar spine. So what we're going to do now is we're going to go to the left. Same thing. Contract the core, rotate, lateral flex. Contract the core, rotate, lateral flex. As you can see, that's a pretty simple exercise. The next one that we're going to do, called the bretzel, is a little more challenging. Okay? As you can see, I'm already in the starting position for the bretzel. You'll notice that my shoulders are stacked on top of one another. My head is supported with this bolster to make sure that my neck does not laterally flex. The importance of the shoulders being stacked on top of one another is, if I'm in this position, I've already started my rotation. It's not controlled the way that I want it to be. So I'm going to bring those shoulders back underneath. From this position, what I want you to do is bring your top leg up. You're going to use your underside arm to support that knee. Okay? The reason we do that is because if that knee falls towards the floor, guess what happens? Your pelvis rotates. When the pelvis rotates, the lumbar spine rotates. We don't want that rotation. We want this to remain stable, not mobile. So what we're going to do is use that arm to support it so that the pelvis stays in a neutral position. From this position, the first thing I usually tell my patients to do is just to kind of wrap their upside arm underneath the rib cage, and they're going to put a little bit of rotation in just using that arm. And what I have them do once they feel like they've reached their maximum is to start to do a little breathing assist. So they'll take a deep breath in, and as they breathe out, they let it sink in a little bit farther. Alright, so that's the easy part. I usually have them do three breaths to each side. Once they're in this position, the next step is to bring that downside foot up towards your upside arm. Once we're in this position, we're going to do the same thing with a breathing assist. We're going to take a deep breath in, let it all the way out. When it sinks, we want to allow that shoulder to fall towards the floor. We want to also draw that foot up towards our buttock. What this is doing is also killing two birds with one stone. We're getting the thoracic mobility, but we're also stretching our hip flexors. You'll notice from this position, my pelvis is still at neutral, thoracic spine is mobile, lumbar spine is stable. Okay? I want you to do this to both sides. If you guys have any questions about anything we just talked about, feel free to check out my blog at betterback9.wordpress.com, or you can email me at the address on the screen. Just remember, with these exercises, we really want to make sure that we're looking for thoracic mobility while maintaining our lumbar stability. Okay? These exercises are pretty simple. They're not static stretches. They're a motion-based exercise. So make sure that you keep moving. All right? Thanks for your attention. If you have any questions, give me a call.